Ladies and gentlemen, welcome again to our 103 FM's Men's Healthcare Hour. I'm your host, Dennis Webster. If you're a regular listener to this show, welcome back. If you're tuning in for the first time, I hope you enjoy the hour. I would like to start off by reminding you to always seek the advice of a physician or other qualified healthcare provider if you have questions regarding a medical condition, and that you never disregard professional medical advice or delay in seeking it because of something you've heard on this radio program. Today we're going to talk a little bit about testosterone, and hopefully we'll touch a bit on later on PD5 inhibitors, so drugs like Viagra and Cialis and Levitra. So testosterone. What is testosterone? Well, it's a male hormone that belongs to a group of hormones called androgens. Now, testosterone is a very important hormone. We need it for things like our muscle mass and strength. We need it for sex drive, for our libido. We need it for sperm production. You also need it for increasing the density of your bones. So it helps prevent things like fractures by keeping your bones strong. Testosterone also helps with red blood cell production. Now, we need red blood cells because they are the cells that actually transport oxygen to all our tissues. So we need to have an adequate supply of red blood cells to keep our tissues adequately oxygenated. And testosterone also affects how fat is distributed through our body. Are you by any chance experiencing like low sex drive? If you are, one cause could be low testosterone levels. Sometimes these low levels are accompanied by things like insomnia, so inability to sleep, or actually disturbances in your sleep. You may also be experiencing decrease in your level of motivation, or sometimes even difficulty remembering things. These are all symptoms that could be related to a low testosterone level. Generally, the main complaint men have with low testosterone level is a low sex drive. But you could also have other symptoms such as less intense orgasms or changes in penile sensations. Your general mood or energy level, as I said, can also be affected. So if you're experiencing any of those symptoms, you may want to go check with your doctor and maybe see if you need to have a testosterone level checked. Now, low testosterone is becoming a common problem today. Many doctors are reporting that a lot of men are showing up at their offices, and after investigations they're showing low testosterone levels. Some of the doctors are attributing these drop in levels to our environment, chemicals in the air, chemicals in the food that we eat, chemicals that we use to clean our homes. Researchers feel that these things are affecting, our endocrine system, and subsequently things like our testosterone level, and sometimes also our thyroid. So it's important, if you're having any of these symptoms, to see your doctor and get your levels checked to make sure you're okay. Usually, treatment starts for levels below 300. Nanograms per deciliter, and that's the measurement that they use. And doctors try and get that level up to between 5 and 800 nanograms per deciliter. And most men have described feeling better with higher levels of testosterone. Now, there are certain things you can do to boost your testosterone naturally. One of the things that researchers recommend is that you get enough sleep, number one. Not getting enough sleep can affect your testosterone levels. So the recommendation is that men try and get between 7 to 8 hours sleep at night. Also, another thing you can do to help your testosterone levels is to maintain a healthy weight. So if you're not at a healthy weight right now, then and you're having these other symptoms, then it's probably a good time to start working on getting that down into a normal range. Look at your body mass index. Maybe you want to speak to a nutritionist with regard to ways that you can work on getting that weight down into a normal range. Regular exercise is also recommended. It also helps boost your testosterone level. And you want to try and work up to about 30 minutes of exercise 3 times a week. And now, as I always advise that you speak with your family doctor before you engage in any sort of physical activity to make sure that it's safe for you to do so. Another way that we can boost our testosterone naturally is by managing stress. Now, that's a very challenging thing, today and anytime. So you may want to speak, if you're having issues with stress, you may want to speak to maybe a psychotherapist or someone who can help you develop strategies to reduce your stress level. Stress, as we know, affects everything. It affects our immune system, it affects our sleep, it affects our blood pressure. So it's important that we look at stress and how it's impacting on our systems and managing it. Another thing that you may want to do also to help boost your testosterone is actually to review your medications. Now, I know of people who've been on medications for years and years and years. A lot of them taking the same dose, as I say, for years and years and years, and never really gone in and had their medication reviewed by their family doctor. Now, it's a good idea to go in and see a family doctor and have your medication reviewed. Sometimes, your doctor, may want to reduce the dose you're taking, especially if you're managing things like high blood pressure and diabetes. So if you haven't seen your doctor for a while, don't let years go by. Get down and see him as soon as possible. For a lot of men, it's not necessary that they have annual checks, but if you hadn't had a check for some time, and a lot of men I've been speaking to lately haven't seen a doctor, for sometimes 5, 6, 7 years, it's about time that, you take the time and, and check in with your family doctor. If you don't have a family doctor and you're looking for one, you can send me an email and I can probably help direct you to a competent physician. My email address is gprl3012@gmail.com. Right now we're going to take a break. Don't touch that dial. You're listening to 103 FM's Men's Healthcare Power. We'll be right back.
Yeah, just about 10 minutes after 9 o'clock. Once again, welcoming you to the Men's Health Clip Hour. We're here talking with Nurse Dennis Webster. And, of course, we started off with a really interesting conversation, a really interesting topic here this evening. So let's remind our listeners.
Right, so we're talking about testosterone this evening. And just want to remind you, if you want to be part of the show, you have some options here. You can give us a call at 628-4103. You also have the option to log on online at 103fm.net, or you can send us a text at 4103, or you can WhatsApp at 299-4103. So that's WhatsApp at 299-4103. So we're talking today about testosterone, especially low testosterone, and its impact, on our system.
Just for the benefit of those listening who may not understand the term testosterone, or what is testosterone?
Testosterone is it's a male sex hormone that belongs to a group of hormones called androgens. Those are male hormones. The majority of testosterone is produced by our testicles. So there's a small amount that is also produced by our adrenal glands. Now, our adrenal glands are glands that basically sit on top of our kidneys. So we have 2 adrenal glands, one over each kidney, and they produce a small amount of testosterone. But the majority of testosterone is produced by the testicles. Now, how it actually works is there's a part of the brain called the hypothalamus. The hypothalamus instructs a gland called the pituitary gland, which is, if you were in a biology class, it's described as the master gland. So the hypothalamus instructs the pituitary gland on how much testosterone to produce. Now, the pituitary gland in turn passes this message on to the testes to produce testosterone. Now, there are some men who have a condition we call hypogonadism. Now, hypogonadism is really our bodies not producing any or enough testosterone required. In a situation like that.
Is there another word for testosterone, or can Testosterone is testosterone.
Testosterone is testosterone.
Can someone get confused with the with sperm? Sperm is the same as testosterone?
Sperm is not the same as testosterone. Testosterone is responsible for sperm production. So you need that to produce sperm. Now, that's an important thing, because especially if a young couple having difficulty conceiving, one of the issues could be a man having low testosterone levels. Yeah. So low testosterone levels leading to low sperm production. Right. So in a case like that, in a couple situation like that, the man may want to go to the doctor and have his testosterone level checked.
But how would he know? How would he know if it is low to start to begin with?
Well, I mean, as I say, if they're trying to conceive and they're not able to conceive, I mean, it's not definitive that that's the problem, but that's one of the things that they may want to look into, is whether the man and the has a good sperm count.
So then it would be advisable for both the man and the woman to go to the doctor together.
Well, the couple together, yeah. We always advise a couple go together, but the man is the one who's going to be checked to see what his sperm count is. Because, as I say, we need that testosterone for sperm production.
Right.
Now, low testosterone, as I say, impacts also on our bones. So for older men especially, testosterone basically is highest in our adolescence up to age 30. After age 30, it starts to decline, I think, by about 1% a year. So the level goes down and down. Now, a lot of men attribute low sex drive to aging. No, it's not always the aging process, because there are a lot of old men out there who are still very virile and still very active. But because of the aging process, it does impact on your testosterone levels. So one of the things,
Are there any other things that impact on the testosterone level?
Well, mainly, as I say, they're saying that.
Because I heard one man. Let me interject. I heard one say overuse.
Yeah.
Is that a factor?
No, I don't think so. I believe that's a myth.
It is a myth.
It is a myth. Yeah. Overuse is definitely a myth. Now, having a lot of ejaculations can reduce your sperm count. May not be giving your sperm time to build up, your count to build up, so it can affect that, but not necessarily not testosterone production. As I say, for some men, it's a inherent defect in their system, their inability to produce the testosterone. So the testicles are not producing, the testosterone they're supposed to produce. Sometimes men with an undescended testicle can have low testosterone production. So when you go to see your doctor, one of the things you'll do is a physical assessment. Make sure your testicles are normal. First of all, you'll do a physical history to see.
But won't the testicle, the testicles, can that be, determined from an earlier age?
Yes, absolutely, absolutely. I mean, young children, for young children sometimes, but as they get older, sometimes that resolves. But sometimes, in young children, that one testicle will not go down into the sac as it's supposed to. So you can have one undescended testicle. That could also cause testicular cancer, like an undescended testicle. So, as I say, one of the things that the doctors will do, first of all, is do a physical assessment to make sure both testicles are there. I mean, I don't know a lot of men today who are actually doing regular testicular check. Right? It's supposed to be doing at least once a month. And I'm sure there are a significant number of men who are not doing that. So
definitely, because the normal man in the street will think, okay, what, everything is okay. Once you're there and you're doing what you're supposed to do, and things is being done, there's no need. There's no need to go check anything.
Right. Right. Until something develops, and you realize, well, wow, it took a while. For example, testicular cancer or growths on the testicle.
How would you realize that something has happened or something?
By testing, by doing the monthly checks.
But without testing, is there something that can happen?
It's difficult. You could get maybe some swelling in the groin, fluid in the groin, pain in your testicles, things like that. Could be signs that something's going wrong and it needs to be checked out. Yeah. So other than that, no. I mean, as you say, if a man is not really feeling like he's experienced a problem,
but that's it. That's it. Normally men would, once once you're dealing with the situation at home and you're taking care of business, so to speak, all is well.
Right.
You know, and once all is well and business has been taken care of, there's no need to go check any doctor or anything of the sort.
Exactly.
You know? And again, it all comes back down to when, once men feel okay, once we're feeling okay,
there's no effort to go get checked out.
There's no haste to go to the doctor.
So we have to change that mindset. Because you're feeling that everything is okay doesn't mean that everything is okay.
Yeah.
You should always, at least once, get an annual check.
Right.
Or check every 3 years. Sometimes, the doctors, they don't necessarily need to see you every year. They could see every 3 years, but you need to know what we call your baseline is, what your starting point is. What's your hemoglobin?
Right.
Right? What's your cholesterol? What's your pressure? What's your sugar? Right? Hemoglobin A1Cs. I keep talking about that a lot also. It's the most reliable test for telling you what your blood sugar is. So, but most men, don't get these things done, so we don't know what their starting point is. So we don't know exactly how long it took for things to go bad.
Right.
I mean, if I'm sure you will agree, to know which direction you're going in, you got to know where your starting point is. So, my recommendation is men see their doctors and find out where they are, what their baseline test results are.
And as you mentioned before, it all starts to diminish at the age 30.
Well, start at age 30, your testosterone levels start to drop.
Yeah.
And as I say, we're seeing a lot more men doctors. I mean, I've been doing this research for a while now, and doctors are seeing a lot more young men with low testosterone levels. So we know the environment, and the pollution in the environment is impacting, on our endocrine system.
But a lot of men would also think, once again, let me, before I make that point, once again, want to remind listeners that you can send your messages on WhatsApp to 299-4103 if you want to, you have any questions, anything you want to ask Dennis Webster here, Dennis Webster, he's with us. 299-4103, that's our WhatsApp number. And of course, phone lines are always open, 628-4103. All right? The point I was going to make is that, most men would think that at age 30,
right?
Testosterone levels begin to drop.
Starting around age 30.
Starts to drop and that sort of a thing. Maybe no big thing because children has already, we covered that already, children and that sort of thing, because at age 35, that sort of thing, to be having babies and so on, might.
Yeah, for some men, that's the way, yeah.
So for some men, that might be it,
Absolutely.
So,
absolutely.
But
I'm saying if you're getting that, if they're getting the other symptoms, for example, especially if things have changed suddenly, you notice, that, you're getting, moody, you're not sleeping well, these could be symptoms, associated with a low testosterone, especially if you're in the age category, as I say, starting at age 30. I mean, there are young men, I've got emails from young men who have concerns about their testosterone level, and they're in their 20s. Now, you won't expect, young men in their 20s to have low testosterone level, and the majority of them, don't have low testosterone levels. But if you have these symptoms combined, so not just one symptom, if you have 2 or 3 symptoms, then it's worth investigating to see if there's a problem. Right? So, as I say, I encourage men. If you're not sure, especially if you're not sure, and if it's outside of your norm. Most people know what's normal for them.
Once again, let's try to go over what are the causes of your testosterone levels to decrease.
Well, as I say, there could be a lot of different reasons.
You mentioned lack of sleep.
Lack of sleep can reduce your testosterone level. Also, if you're overweight. Like obesity affects many things. One of the things also is your testosterone level. So if you're obese, you have to be working on, getting your weight down.
Right.
It's a difficult thing, but you have to start. It doesn't get any better by just leaving it. It only gets worse. So the thing is, it's the best time to start is now.
Right.
Right. Another thing is managing stress. Well, we're dealing with stress on a regular basis. Yeah, so we have to find, ways to reduce that stress. One is exercise, regular exercise. That helps reduce stress. And another thing is to find other ways. Yoga has been suggested, a lot lately, to help reduce stress. So, or finding a quiet area, taking, time for yourself, taking a day for yourself.
This whole issue of yoga, boy, is yoga like a mainstream?
Oh yeah, right. It's I mean, I don't know if if it's mainstream in Trinidad, but there are a lot of people practicing yoga and getting the benefits, from it. Right, so there are huge benefits to to doing yoga, but again, these are things that you need to investigate.
I got a message here from one of my someone here. He actually asked that the way maybe is there any sort of what's the word I'm looking for? Can something happen with regards to the way in which sexual activity is being performed? Rigorous sexual activity, would that
it wouldn't affect your testosterone level?
It won't.
No, I mean
with the mere fact that maybe in a situation where you're the recipient of maybe a lash or some sort of trauma.
Trauma. I mean, you could have trauma to the penis, right?
Or the testicles.
Or the testicles. Yeah, they can also.
Usually, athletes, for example, kickboxing, karate, whatever. Athletes, for example, they always cricket,
exactly.
football, that sort of a thing. Always taking that, lash to the groin area.
Trauma to the testicles could cause that. Yeah, absolutely, absolutely. Anything that affects.
But I think the point he was trying to make though is that he was saying, and maybe he's a little too rigorous in the actions.
Yeah, well, I mean, if you say trauma to the testicles, but more rigorous action would be trauma to the penis, and that can lead to other things.
Okay.
One of the things also that trauma to the penis can lead to is something called Peyronie's disease, which is a curvature in the penis.
Okay.
Right, caused by scar tissue from trauma. So that causes a whole other, and that can also lead to erectile dysfunction. But I mean, the most common complaint that men with low testosterone have is low sex drive. So that's the most common complaint,
What is you want to define low sex drive?
Libido, like you just don't have the interest.
You don't have that interest.
That interest that you had before. It seems like it's dwindling. And like I say, you may notice that dwindling after age 30. As your testosterone level drops, that could happen.
That's a serious thing because at age 30, 35, thereabouts, it's supposed to be men in their peaks.
Right, but it's small amounts, so it's going to be very gradual changes. Now remember, we have other health issues that that men are dealing with on the island. Things like high blood pressure and diabetes. Those can also impact on sexual function. So it's not all low testosterone, but because low testosterone is being such a more common diagnosis today, it's something that needs to be looked at as a possible factor.
That's a serious thing. You're saying, because imagine that low testosterone level. It is the contributor to. It is the reason for low sex drive.
Absolutely.
So there's a lot of men out there right now who's having that issue and hey.
And I know from my articles, right? I mean, like I said, I wrote articles on prostate cancer, and I wrote articles on sexual health. And prostate cancer didn't get a lot of attention, but sexual health seems so. Men are a lot more concerned about their sexual health, it looks like, than dying of prostate cancer. So it's important. It's important on the island, and it's important in most countries. So it's something that you want to pay attention to. There are things that you can do in your diet also to boost your testosterone. Certain types of fish that are recommended to help boost your testosterone, like tuna, whether it's fresh or canned. That is also beneficial to helping boost your testosterone level. It also fulfills your daily requirement of vitamin D. We need a lot of vitamin D. We need zinc in our diet. These are things that can help, with your sexual function. So you want to get zinc, vitamin D, egg yolks. We hear a lot about too much cholesterol. Now, unless you have a problem with cholesterol and you're taking sort of medication to reduce it, egg yolks are a great source of cholesterol because we need cholesterol to convert into testosterone. So that's what the testicles do. They convert cholesterol into testosterone. So we need to have cholesterol in our system. We just have to keep an eye and make sure that it's not getting out of control.
No, because you have to be careful what you're saying there, because men will think that's okay. Cholesterol, hey, let's have a lot of
no, but we need some cholesterol. Is important. Our nerve cells, we need cholesterol. So cholesterol is important. It's not like ban all cholesterol. We can't get rid of all cholesterol. We need some cholesterol for our body to function properly. So.
But we're just about that time when we're getting ready to take just about 15 seconds before we go to that break.
Right.
When we come back, we will get further into some of some of the ways in which we can try to solve this problem.
Absolutely.
All right, so we can talk some more. You're listening to the Men's Clip Help Hour here with Nurse Dennis Webster. He's with us, and of course, once again, reminding you guys that you can send your messages to 299-4103, or you can call us up at 628-4103. Some messages. When we come back, we continue with the show. 9:30, and of course, yes, the Men's Health Clip Hour continues right here on 103 FM. This Dennis Webster with us, and we're talking about low testosterone.
Low testosterone, yeah. So it's, as I said, testosterone it's an important male hormone. We need to have an appropriate level of it in our system for our bodies to function properly. We need it for our bones, we need it for our muscles, we need it for strength, we need it for sperm production, we need it for red blood cell production, which is important for transporting oxygen. Now, a lot of men are taking testosterone, that sometimes they have greater oxygen capacity and they could work out longer.
Let's talk about ways we can kind of solve the situation.
Well, testosterone replacement therapy is actually only recommended, only approved by the FDA for men who are diagnosed with what we call hypogonadism. So these are men who are just producing only little bits or none, or no testosterone. So they take what they call testosterone replacement. And replace.
That is not recommended for everybody.
Not recommended for everyone. And it's an important point because, on the island we have all kinds of physicians. We have rogue physicians, we have competent physicians. And you have to be very careful because...
So is that we have what? Rogue?
Rogue. I call them rogue physicians.
Rogue physicians.
Rogue physicians because...
You know of any?
Well, we're not calling names, right? But they're out there, and
it would be amazing. It would be amazing sometimes, if somebody could just, imagine were going. If somebody just mentioned, like for example, you just mentioned a rogue physician, and to the surprise of someone listening, like, wait, now that's my doctor, boy.
Yeah. Oh, you know your name, yes. No, but you have to be careful.
Imagine your physician is a rogue physician, boy. That's a serious thing.
It's a serious thing. And you have to be careful, especially with testosterone replacement.
Yeah.
Now, a lot of men are taking the injections. And the thing about it is, if you're taking these injections and you really don't need testosterone replacement, what happens is your body basically says, hey, looks like we have enough flowing here already. We don't need to produce any. So it basically could shut down your own production, natural production of testosterone. So you have to be very careful on replacement. Now, doctors have different ideas with regard to what levels they want to treat. So, you have to be careful about, what level he's treating you for. Usually doctors treat levels below 300 nanograms per deciliter. That's the measurement that we use for testosterone is nanograms per deciliter. So usually at 300, and they try to get a therapeutic range up to between 5 and 800 nanograms per deciliter. Now, we're all different. So some men will function even at higher levels of testosterone. They may feel better. So it's important that you have these discussions with your doctor, especially if you're getting treated. You need to give feedback as to, how it's working for you. You find that it's improving, or because sometimes, as I say, a higher dose. And the injections are usually given every 2 weeks to boost your level.
I think we have a call on the line, so let's try to see if we can get this caller or in on the show here this evening. Hello, good evening, caller.
Hi, good evening.
Good evening.
Good evening, Doc, and good evening, Sir Rishiram.
Yeah, good evening, man.
Is there any way you could stop this from happening to, like, males?
Stop the low testosterone?
Yes.
Well, as I said,
you could stop that, like, growing up from small, you could do something that could stop this. Like
it's very difficult. It's very difficult because they're saying a lot of the low levels that are being diagnosed today being caused by environmental factors. So either the food we're eating, the air we're breathing, they've found a lot of, fish, with, tumors and things in them already. So a lot of our fish in our seas or our rivers are polluted. So go ahead, sir.
Okay. Sorry for interrupting you, but I know that even my father always used to say that too much of one thing, good for nothing.
True.
You know that way that if you eat too much of fish, too much of chicken, you know it's bad for you some way or the other, right?
Everything in moderation.
It's like I know all men have suffer with these kind of things, but is there anything that you know someone could do like preventive measures to stop this from happening?
I think one big part of the preventive measure is the awareness, right? Is knowing that this actually does happen, it exists, right? And that we need to be aware that it exists. We need to pay attention, to what we, our diet, what are we taking in, how much of this commercialized stuff are we taking in? We need to pay attention, 'cause our bodies are basically our temples, right? So we want to make sure that whatever we're putting in it is healthy. So,
Thank you, Doc.
Okay, you're welcome. Have a nice...
Some of these doctors we are right now in my country. Oh gosh, that is why our Prime Minister are going to the other countries or anywhere else to go to get anything done. You understand?
He didn't go Mount
So
Hope.
sometimes even if it is you go to meet a specialist, the specialist, they only tell you where everyone always tell you, and you pay a big price to meet them. So it's like people don't take care of themselves because of that same day-to-day business now,
And they're not really getting
So
the information they need.
Thank you for your time, and I want to tell you something. Please stay with us and always at this program, always be here with us to educate us about this, because this is like no other radio station in this world ever started this with us. And always continue your success. Thank you so much.
Well, thank you, sir, for your feedback. I appreciate it, and we'll do the best we can to keep it going.
Yeah, thank you so much.
But thank you for your call.
Thanks,
Okay,
Scholar.
goodbye.
Thanks so much, Scholar. Yeah. Well,
So people worried about this thing. I mean, it's
they are,
it's a real concern.
And, he asked, what can be done to preventative measures. Of course, you mentioned, exercise,
Losing weight.
losing weight,
Getting enough sleep.
getting enough sleep.
Right.
And of course, if you're not athletes, you need to wake up.
But we need to start doing something about it. I mean, we can't be complaining that things are bad and we all have to do our part in making this whole thing better.
You heard what the
So-
caller said. You heard what the caller said. The caller
Yeah.
said one of the reasons why, you mentioned it, rogue doctors, and the mere fact that they kind of like frustrate the whole system in itself. In that, and he made that point too, where our very own Prime Minister decided to seek medical
Outside.
attention outside medical attention. He didn't even trust the doctors that are now here.
But exactly. But our local citizens have to trust the system.
But that's
we
it.
have.
We
They
don't have a choice. We don't have a choice. Yeah.
Right? So how does every creed and race find an equal place in a situation like that? It's not equal, right? So I want to thank that caller for calling in and expressing those sentiments. I think it's important that we keep shows like this going to educate the people, to let them know what standard of care they're supposed to be receiving. When you go to a doctor, what to expect, right? He's supposed to do this, that, and the other. And if you're not getting this, that, and the other, then you need to ask questions. And if you're asking questions and you're not getting the answers from whatever particular doctor you're seeing, then you need to get a next doctor.
Yeah.
What's the sense staying and basically frustrating yourself? We have to change. We have to make a stand.
Well, when you mentioned go and get a next doctor and that sort of a thing. I mean, healthcare in this country is not cheap, and to go from doctor to doctor, to basically to get one answer. To go from doctor to doctor,
Right.
A doctor visit these days $300-400 depending on what is the situation and who you're seeing and that kind of a thing. You know what I mean? And that in itself is a frustrating thing because there are people who have problems and hear what, given the current state of the economy and that kind of a thing, hear what, $500 could do something else.
True.
And hear what. I feeling okay now. I can live with this. And if something's wrong, well, you know what? I can live with that. And that's the attitude. And this basic attitude, that attitude that we have adopted, is what is to our own detriment.
Absolutely.
know?
Absolutely. But we're not getting help with it, you see. Like I said, I've been putting out articles. I've put out over 120-something articles talking about the areas that we need to improve, right? But there's been no move. No one's moving on it. Like, we need to have a champion, right, at the level of the ministry to make a change happen. if we don't get a champion at that level, we just basically spinning top in mud.
All right. So let's talk about all right. You have already the situation. You have
a low testosterone.
A low testosterone level.
And you want to put it up.
What do we do?
Well, basically you have to see someone, usually a urologist deals with low testosterone. Because he would do this, the assessment, check your testicles, check all that sort of stuff. So you go to a urologist, and basically what you're going to expect is he's going to give you some sort. If you're found to have what we call hypogonadism, he's going to give you some sort of replacement testosterone. So you're going to have to replace what you don't have, and that comes in the form of an injection, a patch, a gel. Okay, so the injections, you're going to get injections every 2 weeks, and it's going to take about that time for you to see if there's going to be a rise in your testosterone or not, and whether things are going to be changing. So it's usually going to be, if you're going to be receiving treatment, it's usually a long-term treatment.
So we have another call on the line. Let's find out what's on this caller's mind here this evening.
Hello, caller. Welcome to the show.
Hello, good evening, caller.
Hello, good evening.
Good evening.
I must commend you guys for this program.
Thank you, sir.
But if it's not too much of trouble, I would like for the doctor, Mr. Webster, to explain what is really the meaning of low testosterone.
Yep. Okay, so so men, testosterone, like I said, is produced by the testicles, and it's important for many bodily functions. When we say low testosterone, meaning testosterone usually has a normal range. So there's a low end and then there's a high end. So when we say low testosterone, we mean that your testosterone level is below the low end of what is regarded as a normal level.
But what is wrong? What is wrong when you have low testosterone level? A low testosterone level means what?
Means your testosterone level is low and you're at risk for other things to happen.
Like what?
Like bone demineralization, like low sperm count, right? Like all those things that I mentioned.
Low sperm count, it means low testosterone level means low sperm count, low sex drive.
It means it can impact on your sperm count, so it can lead to low sperm count. It can cause low sex drive,
right?
It can make your bones thinner, meaning that you're more prone to fractures.
Right.
Okay, these are the main things, and it can reduce your muscle mass as well as your strength, because you need testosterone for muscle mass and strength.
All right. Caller, you there?
All those things can change.
Yeah, I am here.
So all those things. So, yes, sir, go ahead.
Okay, so I now understand this thing is really a man thing, right? So if I were to give advice to the men out there, like in their mid, they should step up their physical activities and take care of themselves a little more better.
Absolutely.
Yes, and watch what they eat.
Absolutely.
And what is, right? So I thank you so much.
You're welcome. You're welcome, sir.
Okay.
Thanks for your call.
Thanks, caller.
Like I say, if you keep doing the things the way you've always been doing them, you're going to get the same results you've always been getting.
Yeah.
So if you want a different result, you have to change what you're doing. You can't be eating, barbecue and all these carbohydrates 10 o'clock, 11 o'clock at night, right, and expect to lose weight, right, or not expect to get acid reflux and those things. So you have to change your activity. You have to change how we look at healthcare and how we take care of ourselves. We have to change that, or nothing will change.
Correct.
So
Correct.
These are the issues. So again, if you want to be part of the show, you can give us a call, 628-4103. Send us a text at 4103. You can log on to 103fm.net or WhatsApp at 299-4103. We're talking about testosterone today, mainly low testosterone and its impact on our bodies.
One question that's been burning. There is always, a very high advertising and sort of like campaigning for these herbal things that it could deal with low testosterone. It can deal with erectile dysfunction and that sort of a thing. That's another question. Can low testosterone lead to erectile dysfunction?
Absolutely. That's one of the main complaints.
So the first question is how do we treat with this whole concept of herbs and that sort of a thing? These guys always saying, come to me and use this particular type of herbs and that sort of a thing.
If you're doing herbs, remember that's a field for a naturopathic doctor.
Right.
So first of all, if you're deciding that you want to use herbs or whatever, you should be basically consulting with a naturopathic doctor who has been trained in that particular field. Right? You have to be careful also about combining herbal medication with whatever conventional medication you're taking, because a lot of people in Trinidad taking tons of medication already for high blood pressure, for sugar, for kidney, for everything. So you have to be careful, because sometimes you only get to make the mistake once.
Let's take this call. Let's find out what's on this caller's mind. Hello, good evening, caller.
Good evening. Hello, good evening. Welcome to 103 FM's Men's Health Clip Hour.
Hi, good afternoon, sir.
Good evening, sir.
All right, I direct live to 103.
Yeah, this is
Yes,
103.
this is 103, yes.
You're live.
Yeah, man. I want to ask you a little kind of simple question, right?
Yeah.
It's like tomorrow when you're trial for surgery, but that's like a technical problem. I was talking about them things, so I was just like,
What's
fascinated to ask.
the question? What's the question?
All right, it's like I'm going like it's not like it's not like stone or bladder, it's nothing like that. It's like and from your stone to your body, you have a little kind of veil, there's blood clot, right?
Right.
So yeah,
Hello?
Yeah, go ahead. We're listening to you.
Yeah. And then what I'm talking about,
So
just like from my
I having pain that's going down into your leg.
oh yeah. Well, it's something like that, right?
So-
It's something similar, I thought, but I just want to find out what's the best thing you could recommend that, because remember I agree with my doctor. All right, number one, my mom is diagnosed, right? So, me already much frightened, but as I understand the program, I just called to find out what you suggest.
Well, says it's very difficult, first of all, to say what's going on with you. And I really can't give you medical advice per se. I can't give you medical advice as to what you're supposed to do.
But already frightened. If they're frightened, no worry. That was nothing, But as I say, as a man, 103 is my radio station.
Yeah.
So I'll be listening.
Well, the thing is, we can suggest that you go to the doctor. Go to your doctor, go to your physician, and let him do the relevant testing and that sort of a thing, and he could give you some more information.
I went and did that.
Did you get?
What did he
I
say?
did everything. So tomorrow I have to go in for operation. Well, not for tomorrow. Tomorrow I go for observation. They'll give my check-up and blood pressure. Sure, I think I'm right. And then it'll be Tuesday.
Right.
You understand? But as I was listening to the program, it was sounding so good, so I just had a call and ask if he had any better advice. And
Well, you're already on the right track. You're already on the right track.
You're already on the right track.
You're on the right
sir.
track.
You're seeing a doctor right now.
Yeah.
What I would recommend you do, though, sir, is make sure you keep copies of all your reports and all your testing reports that you have
I
done.
have all them things, all the documents.
Keep it in a file, right? So you could refer to later on if you need to. So that's about the best advice that I could give you. And let us know how it goes with with your doctor and your checkup.
All right. So when your program will be on again?
Every Tuesday night, sir, from 9 to 10.
9 to 10.
Yeah. So you'll call us next week Tuesday, and you'll tell us how everything went.
All right. Well, by the grace of God, I might come home next week Tuesday or Wednesday.
All right.
Okay,
Good.
we'll pray for you.
Because I'll go in tomorrow, so after the weekend, what I'm out, right?
Yeah.
Well, the very best of luck to you, sir.
Yeah, man.
All right, thank you very
Have a
much,
nice
sir.
evening.
All right, man. Thanks for calling, buddy. Take it easy. Yeah.
Yeah, same to you, brother.
Yeah, buddy.
Thank you.
All right. Okay. Well, we wish him all the best now.
Absolutely.
And he's on the
absolutely.
right track already because
Absolutely.
once you take it to the doctor and the relevant test is being done and that sort of a
He's the
thing.
person supposed to actually guide you
That's it.
properly. So,
That's it. That's it.
So that's good. So wish him all the best with that. Thanks, caller, for giving us.
Yeah. Back to the question that we were talking about herbs. We were talking about herbs.
Yeah, so we have to be very careful with herbs.
Yeah.
Most of the conventional drugs come from herbs. So we can't say, herbs are this, that, and the other. Herbs, they are beneficial, but you need to have the right guidance. So you need to make sure that the herbs that you plan to take or whatever don't interact with anything you're taking already. Because like I say, sometimes you only get to make that mistake once. and you don't get to fix it. So these are things you can check. There are, I'm sure, herbs that give you, some benefit. A lot of the herbs have some of the, these ingredients that are similar to conventional drugs. Now, testosterone, the only way that you can really get that replaced, like I told you, is either injection, a patch, or a gel. There are no tablets that will really raise your testosterone level if it's low to an appropriate therapeutic level. So
what is and then the other question I had asked was erectile dysfunction. Erectile dysfunction, when you begin to experience erectile dysfunction and go through that
right.
That is a goner. It has already begun.
No. I mean, if you I'm not sure I understand you correctly. So you're having erectile dysfunction.
Well, right. Because you mentioned that low testosterone level will lead can lead to erectile dysfunction, that sort of a thing.
Correct.
Is that irreversible? Can that
so
be?
If it's low testosterone that's causing it, chances are when they get it into a therapeutic level, an appropriate level, that should help resolve that.
Okay.
Remember, there are many reasons for erectile dysfunction.
Right.
Low testosterone is only one reason.
It's only one reason.
Right? There could be also a psychological reason for that.
Yeah.
That's why we encourage men or couples, to basically see the doctor together, because you want to eliminate a psychological problem also.
Right.
Right. But if it's low testosterone that's causing erectile dysfunction, getting it back into the normal level should help improve that.
Correct.
Right.
Correct. So don't think that because you're having this issue of erectile dysfunction, it is that a low testosterone level, and it is the sole cause of it.
If it's a sole cause, it can be fixed. You can get replacement that could get you right back on track. Okay, but the key is if you feel there's a problem, you need to get checked.
Correct.
So it's not going to go away by itself. Go and get checked.
Correct. So we're just about 10 minutes before we get ready to wrap up the show. Once again, reminding callers quickly, you have 10 more minutes before you can, if you have any burning questions.
One thing we didn't talk about, Richie, is also that, there's also side effects of, associated with taking testosterone replacement. Testosterone can make your blood thicker. So that can also lead to things like blood clots.
Yeah.
Now, a blood clot that gets dislodged can, go to your brain and cause a stroke. So these are things you need to, to keep in mind, right? Another thing it can do is increase the oiliness of your skin, so it can cause you more acne.
Oh, okay.
So you want to be paying attention to things like that. If you all of a sudden you're on testosterone and you're developing acne, that's something you're probably.
But it is the other way around in teenagers, because in teenagers, there's
they get the acne,
that sort of thing.
And some of
but
them
they usually a high testosterone level.
Right. But if you're getting replacement, so if you're a teenager and you got through that, and you get into now in an area where you're low testosterone and you need replacement, you can get back on the acne.
You could get back
to
there.
the acne again. Yes,
okay.
Absolutely. And also can be a problem for men who have liver, kidney, or heart problems. Now, testosterone has also been associated with increased risk for heart problems.
Let me stick up in there. Let me take this caller. Let's find out what's on this caller's mind here. All right. Good evening, caller. Hello. Good evening, caller.
Good evening.
I know what I'm in the talk. Yeah.
Yeah, go ahead.
All right. Me and my baby trying to have a child for a little while, but it wasn't my problem. It was she problem. And I really don't know what to say. I don't know what is she problem. But the doctor said everything on my side. Everything all right. So I don't know. If we can help me with that.
What's the question? You all trying to have a baby?
Yeah.
And you're having trouble having a baby?
She can't conceive.
Okay.
But you went to the doctor already, and the doctor said it's...
All right, don't worry. Went to the doctor, right?
Right.
But we didn't really get through to say get through. You understand?
Yeah.
So, doctor said we already had to come back and so forth, right? But I got and... But basically, she goes and I just have no idea why.
Do you have any other children with this lady, sir?
All right, yeah, one kid.
Okay, so you have one child with her already. No, and you've been trying since then.
She is about 3 years.
Okay, and you've been...
And so that's just like, that's like, well, we never had a kid, and you know what I mean?
Yeah, you had one already. Yeah.
Yeah, so that, well, so if I want, I can have two.
Yeah.
True.
So she too did the test, right? She did test already, and the doctor said that she's okay.
Huh?
She did the test already too. She did the relevant test, and the doctor said that she's okay.
Yeah, we went and did everything. But yet till after that, well, I really don't know.
Well, so that looks like it's going to need some further investigation. So, I would, follow up with your doctor.
All right, don't tell me that's never right, man.
No. Now like you said before, we told you before, you're already on the right track. You're already on the right track, and you're doing the relevant, your checks and so on with the doctor.
I do the relevant investigation and
right.
everything, right?
Yeah, so you're on the right track. Yeah.
So
but I still kind of frightening now.
No. Don't be scared. Don't be, don't be alarmed.
It's normal, sir, to be alarmed and to be concerned.
Well, that's what I'm saying.
Yeah,
But what's the thing out? Well, we had a kid, right? Yeah, right. And we going to our second kid, and we going to the doctor after. Me and she was together, right? Well, if you understand, me and she was together, right?
Yeah.
And then after. No, when I was with the doctor, no, I heard something else. So I must be alarmed.
Well, like we told you before, you're on the right track. You're doing the correct thing already. So don't be too scared about it. Just go through the motions.
Well, I have to be frightened a little bit.
A little bit is okay. 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 That's normal.
Yeah, you got done me?
Yeah.
Thanks for calling,
Thank
brother.
you for the call.
Thanks for the call.
Yeah, man, thanks.
Okay, all the best.
Man.
Okay.
The man doesn't want to be frightened,
But
he's frightened, but he doesn't want to be frightened. But
concerned,
hey, it's a normal thing. It's a normal thing.
Absolutely.
Yeah.
So we had to...
Quickly, so we mentioned, ways in which we can,
where we can replace the testosterone. So it's injections, a patch, or gel. And you have to be very careful if you're using any of the patches and the gels, because you don't want little children, or you don't want your partner to actually touch it, because the gel can be transferred through the skin and affect children or anyone touching it. So that's the way the replacement is. So if you're putting a patch on, you take the patch off, but you don't want to be touching the drug is on the patch, so you don't want to be touching that. You don't want little children actually touching that. So make sure that that's away from them.
Well, we're just about 3 minutes before we get ready to wrap up the show. This evening we've been talking about low testosterone levels.
Low testosterone, and it's as I say, it's becoming a more commonly diagnosed condition in young men. And we know that your testosterone levels start dropping at age 30. So, as the years go by, it's going to be lower and lower and lower. There are ways you can do to actually boost it. We talked about that, getting enough rest, watching your rate, getting regular exercise, managing stress. And one important one, like I mentioned before, is reviewing your present medication with your family doctor. And if you haven't done that for some time, I suggest you get on that as soon as possible.
We have about 2 minutes. Let's take this caller fast. Let's see who's there on line 5. Hello, good evening, caller.
Yeah, hello.
Hey,
good evening.
Yeah, good evening. I tune in to your program, and this is the first time that I'm listening to your program. My question is, how can someone go about getting this checked? Already, how could somebody go about getting this checked?
So if you're concerned about low testosterone, you just, you basically go to your doctor and he will order a blood test for you. It's a simple blood test. Okay. What you should know though is that you should have that blood test done first thing in the morning, because that's when testosterone levels are at the highest. Yeah. Okay. So it's just, all it takes is a blood test to tell you, what your level is.
Okay. And the second question is this. I don't know if this is a myth or if this has any fact to it, but is testosterone in any way linked to aggression?
Aggression. I mean, I've heard stories of they say, this fella here, his testosterone must be high. I don't know if there are any clinical trials that have actually been done that would, that confirm that. So I can't say yes or no. My gut feeling is probably not, but
Okay.
like I say, I can't say definitively.
Okay.
That's it,
All right. Okay. Well, and is there any way that you're recommending, particularly any doctor that you're recommending, particularly?
No, I recommend you go to. Recommend you go see a competent doctor. Okay, and I recommend that you also go to a reliable laboratory, because we have a proliferation of laboratories in Trinidad and Tobago, and a lot of them don't really have any guidelines for making sure that the equipment is functioning properly, that their staff is trained properly, and that the results that you get are accurate. Okay, so thank you for your call.
In that light, I mean, I know probably you don't want to endorse.
No, I can't. I can't.
Yeah, I know you can't, but can you direct me to a resource where I can search for a competent laboratory?
I would start with laboratories in Trinidad, and I think, some of the good ones will be coming up first. But that's all I can say, because I really can't endorse any particular laboratory.
Yeah. No, I understand.
Right, that's a good point you make.
Thanks very much.
Okay, sir.
Thanks so much, caller.
Thanks for your call.
Well, we're just about a few seconds before we get ready to wrap up the show this evening. A quite interesting show. Final words, Ms. Webster.
I always like to, finish the show with reminding people to don't be afraid to get a second opinion, especially in a case of serious illness, and don't be afraid to find a new doctor if you don't feel that you're receiving proper medical care. Your health is way too important to place in the hands of a provider who hasn't earned your confidence, isn't addressing your questions or concerns, and in your opinion, not giving your condition adequate time and attention. You've been listening to 103 FM's Men's Health Club Hour. A pleasant good night to you all.